Hello guys, welcome back to my channel. For today mental health talk, we are going to discuss on the three broad classes of psychoactive substances. Last week we discussed on the psychoactive substances, the effect of psychoactive substances on the mental health aspect, and we discussed the meaning. We look at the meaning of psychoactive substances and the cause and effect of psychoactive substances, which I explain in details about the psychoactive substances. But for today, we are going to look at the three broad classes of psychoactive substances. Has different kinds of broad classes that affect our mental health. But for today, we'll just only look at the three classes of psychoactive substances. One classes of psychoactive substances is depressants. From the word depressant, that is, it decrease every activities in the body. It decrease every activities in the body. That is, depressants slow down the central nervous system, resulting in the relaxation, sedation, and decrease anxiety. When you talk about depressant substances, those are those substances that once individuals take those substances, it will affect every activities in the body. The way things work in the body, it won't be the same. For example, someone that takes alcohol, because alcohol is one of the depressant substances. If someone takes alcohol, everything about him will decrease. The way the person will walk, it will just be cool and calm. That is why sometimes when you see someone who is under alcohol, the person will stagger. There is no more that energy to stand and do things. Majority of them will be on unconscious stage of mind because they don't know what they are doing at that moment. Majority of them will begin to say a lot of things. So these depressant substances always slow down every activities that run from our CNS, that is the central nervous system, or the activities from central nervous system down to the peripheral nervous system, and it will definitely induce someone's sleep. Sometimes people under substances, alcohol substances as an example, majority of them might be sleeping, too long of sleeping, or many of them might not be able to sleep well, because sometimes you will see our body differs. Sometimes you see some people, when they are under substances, they might not be able to sleep. That is when poor sleep will come in. Some of them will begin to talk throughout the next day. They'll begin to remember things that has happened many years, because they are already taking a substances that decrease every activities in their body. It will make some of them, it will make them to sleep longer than the way they expect before. Why some, it will keep them awake depending on the body system. But what we're supposed to ask on this is there is always effect on this, because everything that happens to our body is definitely happening to our brain. If there is any problem in the body, it will definitely affect the brain aspect. That's the depression. We have many of them, something like benzodiazepine. All of them, they all induce sleep. The individual might not be able to sleep well. You have poor sleep, an issue with sleep, and which can lead to many issues in the body. The second one is stimulants. Stimulant is the opposite of depressant. Stimulant, all it does is to increase activities in the body. Activities, energy, attention, by stimulating the central nervous system. This is the one many of these celebrities always abuse. Once they want to go to stage, they want to be alert, they want to be agile, they want to perform. So our mentality Their mentality believe that once they take these substances, they'll be able to perform very well. They'll be able to do things perfectly. They'll be able to do things perfectly. But sometimes we don't think about the repercussion in future. So this stimulant drug, one of the example is cocaine. You know, cocaine is very, very dangerous in the body. Once someone is under cocaine, you know, a lot of things begin to happen. You see kind of extra energy. Though I have seen someone that took cocaine and it depressed the person. So that is why I said when I was explaining the depressant that our body differs. But majority on cocaine, they are what they does is increase activities in the body, stimulate, give more energy to do things. That is when you will see someone who is under substances like cocaine and vitamin nicotine. You will see them, they will have this elevate kind of strength, extra strength, that you don't even know where this kind of strength is coming from. So things like that, but it normally affects our mental health. Sometimes you see some of them will begin to have this kind of elevate high heart rate, blood pressure. Many of them, you see the way they will breathing, the way they will, some of them, the breathing rate will be very high, and it might also produce feelings of euphoria. You see some of them, they will be too over happiness, over high, intense. Everything will just be too much of energy, which can even sometimes lead to this kind of mania behavior, attitude, that maybe someone who is very aggressive might end up being violent because of kind of energy he or she have. So stimulant drugs like cocaine is very dangerous in the body. Sometimes some people consume this kind of substances. They said it doesn't do me anything. I'm cool with it, because majority of them depend on it. They feel like with this, it's like a coping strategy for them. But there is always a problem in future, which we are encouraging that whoever is under substances like cocaine and amphetamine, many of them that cause this kind of that does anything like stimulant alertness, increase activities, need to stop it to avoid issue in future. And the last one is hallucinogen. From the word hallucinogen, it's like hallucinating. When you see people, they will begin to hallucinate. Hallucination is something like perception, and hallucinogen alters perception. You see people begin to see, begin to hear, begin to view, sense a lot of things which other normal people cannot sense. You see someone say, I'm hearing they are calling me, I'm seeing some things, can you see it? Because the person is already under substances which has already changed all the activities in the body. Then the way some of them, you see their mood might not be the normal mood that they used to be before. This hallucinogen drugs can also alter perception like cognition, the way the person thinks, the way he reasons, everything might be abnormal. Then the visual aspect, someone will be telling you that I'm seeing this, I'm seeing that. Many of them will hear some kind of things which other people are not hearing, because they are already under substances, classes of hallucinogen. Example of these drugs is LSD, MDMA, ecstasy. They induce profound changes in sensory perception, thought patterns, and emotions. So this is what this hallucination does. It will change individual thought pattern, the way the person think. You will see people begin to think upward, begin to, many of them will plan things they will not be able to achieve it, because they are under a substances that has alters their perception, alters their thoughts, and their emotion, which is the feeling, the way they feel is always abnormal. So once all these feelings, this thing take place, the behavior will be totally abnormal. So before you know it, the person will now end up in a hospital or end up in a psychiatric home or a rehab home for a proper treatment. So for things we should definitely avoid it. How can we avoid it? It's just for us to stay away from all these substances, because walking around the different streets, before you get to a particular state, you see people abusing substances. When you try to encourage, tell them that these substances are not good, young youth, they don't really know, they don't care. But let me tell you that there will be a future. All these things is going to affect you. Haven't you experienced somebody who was very agile, strong, healthy, young age? Someone that abused substances, then getting to a certain age, you see different kinds of sickness begin to show up. So things like this, there is always effect. Maybe when someone gets to kind of 60-year geriatric age, that your body, some kind of hormones and activities in the body is already on relapsing stage. They don't have that strength again. They are weak. All those things will begin to show up. Maybe things like those substances individual has consumed when he or she was young. So that is why we need to stay away from all these substances. Some of us said we can't sleep. Somebody said I can't sleep without cocaine. I can't sleep without alcohol. I can't sleep without marijuana. I can't sleep without this and that. Please, I'm telling you that you are killing yourself. They are not a coping strategies for you. All you need is to see a professional mental health who can help you, encourage you, psychoeducate you, to bring you out, because you can't depend on these drugs for you to be fine, for you to be good. Majority of us has developed this kind of attitude that anything that happened to you, if not alcohol, or some of us has even looking at this all these herbal roots that we put alcohol inside and be drinking it. They will be saying it's kind of medication, it's medicine for this and that. See, let me tell you, you will get to a certain age, all those things you are taking will start affecting your health, affecting everything about you, the movement in the body. That is where you see some people, before you know it, they will diagnose of cancer, they will diagnose of liver failure, they will diagnose of different kinds of sickness or illness. These days, when you get to psychiatric home, whether private or government, private or public psychiatric hospital, you will see a young youth, just young men, youths, majority the youth. What is the issue? Substances. Why can't we stop it? Because this thing used to have effect in our body. Especially when we get to a certain age, it will definitely affect our health. So I believe with this little knowledge we've learned about these three classes of psychoactive substances of depressants, stimulants, hallucinogen, will help you, and for you to know that there is always effect when someone is under substances. It will affect the way you think, the way you behave, the way you feel, everything about you.